Welcome, everyone. My name is Liz Lazo, and I would like to welcome you all to today's national webinar hosted by the AATC National Coordinating Resource Center, presented by the AATC program. Today's session is part of the HIV and COVID-19 Winter Webinar Series. I'd like to now present today's speakers. So today's speakers are Dr. Stephen Brady and Karen McKinnon. Dr. Brady is currently the Associate Dean of Graduate Medical Sciences, Director of the CACREP Accredited Mental Health Counseling and Behavioral Medicine Program, and a professor in psychiatry at Boston University School of Medicine. His teaching interests have focused in the areas of human sexuality, psychotherapy, skill development, and career development, with a focus on emotional intelligence. Dr. Brady's clinical teaching and research interests over 30 years have focused on the psychosocial and sexual needs of marginalized groups, including men who have sex with men, mentally ill and homeless individuals, and people at risk for HIV and other sexually transmitted infections. Karen McKinnon is the Director of Behavioral Health for the Northeast Caribbean AATC and for the New Jersey Behavioral Health and Primary Care HIV Integration Project. She has been involved in behavioral health capacity building for the HIV workforce since the early 1990s, receiving funding from SAMHSA, HRSA, and the New York State AIDS Institute. As a research scientist at the New York State Psychiatric Institute for the past 3 decades, she also has conducted studies at the intersection of HIV and mental health in the U.S. and Brazil. During that time, Ms. McKinnon has created training programs for HIV care team members, helping people respond to the mental health consequences of 9/11, the Puerto Rico hurricanes, and COVID-19. So today's webinar will address how providers can explore and optimize coping support and resiliency in response to COVID-19. Today's learning objectives is to understand reactions to stress and anxiety that we experience as members of the healthcare community, review approaches to burnout and compassion fatigue and how to address them in our daily work, and identify opportunities to build and maintain our well-being. At this time, I'd like to pass it over to today's speaker.
Great. Thank you so much, Liz. And I want to also thank my co-presenter, Karen McKinnon, who took the lion's share of the work in terms of putting the slides together. So thank you both very much for your assistance. We thought it would be real helpful to give you some context today about how do we come at this. And I think I would say Liz sort of gave you some overview of my background, but I think it probably makes sense to say that I'm an older gay man, and that this is the second pandemic that I've lived through in my life. And in some ways, there was an article in the New York Times talking for those of us who are around for the first pandemic, there's a weary sense of deja vu for certain aspects of this, and that may be true for those of you who are long-standing providers also, and or for the LGBTQI people in the audience who have often been involved in the issues of HIV and AIDS over the course of their career. I've also, as was alluded, I worked at the Boston University Medical Center for over 30 years in a whole bunch of different capacities. But I think what I would say is I still am an active clinician, and I primarily see health providers in my psychotherapy practice. And I was telling Karen and some other people, my practice has just exploded lately. And I'm seeing a lot of healthcare providers, either people on the front lines of dealing with COVID and or people for whom it seems as if medicine is changing right under their feet, that the whole infrastructure or system or lack thereof of healthcare they're having to confront in various professional roles as physicians or nurses in the expanded role, so on and so forth. And then I'm also someone who has a long-standing interest in wellness and self-care, and in fact the graduate program I run is called Mental Health and Behavioral Medicine, and I've been a proponent of how to sort of manage ourselves across a lifespan. And I think this year has been a test for all of us. It's a test for me. I would say that I started the year with the good death, if you will, of my mother, who I didn't think that would be the high point of the year, but in some ways it was because she passed prior to COVID and prior to what's been happening in assisted living and nursing home environments. And it was a beautiful kind of passing. And although traumatizing, really speaks to how much has changed in this year and pre and post COVID. And then, of course, the context has to be understood in the context of some reckoning or not with racism in our country and the Black Lives Matter, the importance of the Black Lives Matter. And I'm a citizen. And so what's been happening even in the last few weeks is appalling and frightening, and I'm trying to cope as well as you. So that's some of my context in terms of how I come at this. Karen, you want to introduce yourself?
Sure. So hi, everybody. It's so great to be here with you. Thank you to Liz and to Steve for, jointly making this happen today. So I live and work in New York City, and as you've seen a little bit in my bio, when 9/11 happened, I was actually doing this same job, which is basically running a mental health training program for HIV care providers. And recognizing that we were facing a historic traumatic event, we realized we were in a really good position to mobilize a big mental health workforce, which was our usual pool of trainers, to help folks get through a period of fear and loss and uncertainty. And our AUTC's co-PI is a psychiatrist, Francine Kornos, and we turned to our disaster psychiatry colleagues and held a sort of trauma boot camp, getting training from a trauma expert named Edna Foa, who helped us really develop a series of programs for HIV care teams throughout the city to help their clients, but also themselves. So then flash forward to a few years ago, 2 hurricanes devastated Puerto Rico and the U.S. Virgin Islands also to a great degree. And those are both regions that are part of our AETC region. So, our program director in the Virgin Islands was forced to live with his 4 kids in his car, and our lead in Puerto Rico lost electrical power for months, and she was caring for her elderly mother who was taking medications which made her prone to stroke if she overheated. So their neighbor down the street miraculously had power, so this woman cobbled together enough extension cords, to be able to plug in a fan to keep her mother alive. So when they told us how they were doing in the aftermath of all of this devastation, their stories still had this kind of intensity of lived trauma and of this need to kind of bear witness and be heard. And we knew we needed to do something to help them, but we also wanted to help the providers they were trying to help and the clients of those providers. So we put together a well-being toolkit to help them understand who was suffering but doing okay and who was not doing okay and needed immediate help, and what they could do to help people through the months of chaos and stress. So when we presented this toolkit at a Ryan White conference, many people came up to us afterward and said, this has applicability to us. We had an active shooter in our clinic. I'm from Alaska. We're recovering from some major earthquakes now. Or, we live in California. We've been affected by the wildfires going on here. So, last March, when New York City clearly was becoming overwhelmed by COVID-19, as we are again now, unfortunately, and as a lot of the rest of the country is, we worked with our mental health team to offer some HIV programs, various approaches to processing the distress and promoting healthy ways to try to manage it. So this was for care team members and their clients who, were experiencing the same disaster this time of pandemic. And as Steve said, there's also been the pile-on of civil unrest and a stressful election. So today we're hoping to check in with you, find out how you're managing, and really offer some health information, mental health information, and strategies to help you get through this scary and upsetting time. So we thought we would actually start with some polls, which Liz is going to share with us.
Great, thank you, Karen. So we'll get started with question 1. And as you can see, the question is, to what extent are you experiencing greater distress as a result of the COVID-19 pandemic? So I am going to put that on our screen in you can go ahead and start choosing your answers. You have over 100 participants today, so I'm just going to give it a few extra minutes. I know we have a lot of people in the room, so I want to give everyone a chance. So once the numbers start slowing down, we'll close the poll. Okay, so I'll give it just another 10 seconds. And go ahead. So Karen, I have now opened, broadcasted the results.
Okay, awesome. So very few people said that they had not experienced some increase in distress, and it looks like the majority of folks really are in that moderate amount of increased distress category. And that's, really sort of how we've been seeing things play out as we've been doing the same kind of poll in our COVID mental health trainings. I think, a lot of what we're going to discuss today is going to help you figure out how to, mediate the increased distress that you're experiencing and hopefully give you some tips for yourself and for your clients as well as your loved ones, because let's face it, we're all going through this at the same time. Some of us are, experiencing certain extenuating circumstances that others are not experiencing, but for the most part, this has been a very stressful and chronic. We're verging on this 1 year, anniversary of when COVID really had a huge effect in our country, this very chronic set of upsetting circumstances. Anything you would add to
Karen,
that, Steve?
Yeah, I would just say I think what is unique, and you touched on this, is this idea that we're going through this at the same time as our clients is. In many ways, that's sort of unusual that globally, just about everybody we touch, they know we're touched by this. And in some ways, it creates, I think, an increasing opportunities for intimacy and transparency and empathy, but it also can make you feel a little exposed. So I think that's what's unique about this particular pandemic, which is really impacting all of us. So
Good point.
that's all.
So then maybe Liz can introduce the next question for us.
Yeah. So for polling question 2, what has been the most prominent source of your distress? Loss of a personal sense of safety, including worries about housing or other basic needs, feeling traumatized by the upheaval COVID-19 has caused more generally, worsening of pre-existing and or new onset of substance use and other mental health disorders, struggling with loss, grief, and or loneliness, or no increased distress. Now I'll go ahead and move the I'm just going to give it another 10 seconds. Okay. I'm going to go ahead now broadcast the results.
Okay, so it looks like, again, most people are in the second category about feeling traumatized by all of the upheaval that's been going on generally around COVID-19. Others have said they've had a loss of personal safety, including just, having concerns about their basic needs. A few people have said they've had worsening of some of their ongoing mental health issues that they've, maybe previously struggled with. And then that sense of loss, grief, or loneliness is really prominent for quite a number of folks. And a few people really haven't had that experience of increased distress and have in some ways, felt fortified enough to weather everything that's gone on over this past year. And so I wonder, as we're going through the presentation today, if you would feel comfortable reflecting on some of the things that, come up when we ask you these questions, if there are things that you've personally found to be super helpful to cope and find ways of being supported through all of these experiences of distress. We would love to hear about those and for you to share those out to the extent you feel comfortable doing that, because I think it's helpful to everybody to hear how folks have weathered this. Steve, any other thoughts about that?
Yeah, I think we really, I think because it was perhaps wedded to this idea about housing and other basic needs, we may have, could have been separated into two categories, really, the loss of personal safety regarding COVID. I mean, how does it affect our psyche when every time you're outside, you're scanning the horizon, you're worried about, there's a kind of level of vigilance around safety and infection control that I think does undermine functioning. I had someone was sharing with me the other day that he went and visited his godchild for the first time using kind of safety procedures. And this is a child, almost one, has never been around another person other than mom and dad, and absolutely lost it. And that they deduced that, that during this very crucial period of time, this child's sense of safety with strangers or stranger fear, which it's normal to feel that about one, but seemed so intense. So I think we don't know the implications of this over time, developmentally across a lifespan, from infants to those of us who are older. So enough.
And I also see that there was a comment in the chat about how this was a very hard question to answer because, you're feeling like several of these things compound one another. If you've had deaths of clients or patients from COVID, the loss of relationships and loneliness, and uncertainty about the future, those things all definitely pile up. And so I understand that this is a tough call to make, as if one of these actually somehow takes precedence over the other, because they all definitely have their combined impact.
Yeah.
Thank you for that comment.
Okay. So moving on.
We just have a few more poll questions, and then we'll commence.
Great. So for polling question 3, how have you been working during the pandemic? Exclusively remotely? I started off remotely, but am back at work in person. I have been working in person all along. Okay. So seems like it has slowed down. I'm going to give it another 10 seconds to give people a chance to respond. But there are some responses in the participant chat, Dr. Brady and Karen, that seems to be outside of those choices. You may want to look at that. Okay. I'm going to go ahead and give it. Okay. So I'm going to go ahead and end this poll and broadcast our results.
All right, so maybe we didn't provide actually all of the response options that apply to how you all have been able to continue working, but this does look like most people have been exclusively remote, but that a pretty even split, is now working in person again. And I wonder, again, if you feel like commenting in the chat, if the people who are working in person could just speak to what it feels like to have been there all along, or what it felt like when you first went back to work in person, and to maybe guide those folks who are still working remotely through that kind of transition, because some of the trainings that we've been asked to do really have to do with how do you get to that point where it's safe, you feel ready, you're not going to be overwhelmed when you get there with your own personal safety concerns. Those kinds of issues come up all the time. So we would love to see some comments about that. Steve?
Yeah, I'll just say that I'm one of those people that the 3 ABC doesn't or don't apply to me. We do what we call learn from anywhere at the university. So I go in a little bit, but I'm largely remote. But I go in a little bit with trainees who are in places like jails and assisted living facilities, and already in a small precepting, just a group of 8, 1 had COVID and 2 had to quarantine. So it's even going in a little bit sometimes can confer significant risk in some settings. So we're fortunate our university does comprehensive testing and contact tracing, so I feel relatively safe. And with the possibility of a vaccine, I'm chomping at the bit, so to speak, to get in line.
Thank you. So then our final polling question, just to launch us off here today and check in with you guys. Turn it over to Liz.
Now that vaccines are being rolled out, how ready do you feel to get vaccinated? Ready immediately. More comfortable waiting and see how it goes for others. Not planning to get vaccinated. And just to, again, looking at the participant chat, another option was that some have already been vaccinated.
Oh, indeed. My how things change in a few weeks.
Absolutely.
I'm just going to give it another 5 seconds in the poll, but again, it seems the other option, D, was already vaccinated, and that's in the chat.
Super.
Okay, and I'm going to broadcast our results.
All right, so as Steve said, he's chomping at the bit. You guys look like you're chomping at the bit to get that vaccine if you haven't already, and I did see a lot of comments in the chat box about having already received it with maybe some hesitation, but that you were able to overcome, and I just wonder sort of what made you ready, what got you to that point, if people feel like commenting about that. And then, there's some people who are taking the wait and see approach, which is understandable with anything new. It's scary. You have to weigh the risks and benefits and figure out what your own situation is and whether it's the right thing for you to do at this time, whether it's even being offered to you at this time. And then some folks are not planning to get vaccinated, and there may be a number of reasons for that, which would be very interesting to hear about. But again, these questions were really just meant to sort of take the pulse of everybody who's here with us today to find out what's been going on in your work lives and as you've been trying to, cope with and manage COVID-19 in your own work lives and personal lives. So I'm going to leave the polling questions behind now and just start with some of the content that we wanted to share with you today. So when you heard me talking earlier about approaching this as a disaster, so disasters are hazards, obviously, natural or human-made. They can be intentional or unintentional or a combination of both, but they tend to have an impact on the whole community and can cause injury and death. So they are perceived to be major crises. And in public health emergencies, including COVID-19, the entire community is at risk. And so as Steve was highlighting before, that's a fairly unique thing for us to have experienced. Having thought through sort of how I came to do this work, I realized how old I actually am, given all of the sort of disaster events I can speak to from personal experience, though I don't feel old in the least. But these kind of disaster events are conditions that stress us out, and those stress events can have long-lasting effects, and we're going to talk a little bit about how to recognize when that might be happening, but also how to try to reduce the effects of stress and distress in your life. And then, as Steve also alluded to, the healthcare infrastructure can completely fall apart during a disaster. And dire emergency care really can be prioritized over the expensive chronic care needs, which is obviously the case with our clients living with HIV. They have chronic care needs. They need to have their labs done at routine intervals. They, may have had a lot of pre-existing behavioral health conditions because that's what the literature shows, and those behavioral health conditions can affect care at every step of the HIV care continuum. So it's often a lot of work to keep folks engaged in care. But it's important to stress that people living with HIV are extremely vulnerable during and after disasters, as are we, the people who are caring for them. So we're going to talk more about that. I wanted to read this quote. These quotes came out of the New York Times, and this is a nurse speaking. She said, "The look of fear of dying in many people's eyes will never be erased from my memory. I feel rage and helplessness because many families have not been able to say goodbye, so much lonely mourning. But it makes me feel a bit better to know that although their families were not here, we were there holding their hands in their last moments." And this, I think, speaks to what Steve was talking about in terms of losing his mother earlier in the year before COVID. There are things that people haven't been able to do in terms of saying goodbye, processing their own losses.
Mm-hmm.
And these are really long-term, impactful kinds of memories that we encode in our brains that we, have to really contend with as we process the initial distress of, losing someone. But, it can compound our grief and really take us a lot longer to get past it if we're not able to do the usual saying goodbye and other kinds of rituals that we tend to do when we're mourning somebody. So
Karen, I think Karen, I was going to say that a number of people in the chat, I think, are making a similar point, particularly people that have been in person starting at the very beginning, talking about how, in a sense, they're just now catching their breath, and there's a sense of, the things that they experienced, these traumatic events from almost a year ago, although in most instances things have improved dramatically in terms of access to PPE and fewer patients dying. The legacy of that does live on. That's where this self-care is so important.
Thank you. Thank you for monitoring the chat and for really bringing that to everyone's attention. I appreciate that. So the HIV workforce has been called into action in so many ways. The healthcare skills that you may have when you're working with your HIV clients, may be called upon to help, respond to COVID-19. I know that a lot of my colleagues at the Department of Health and Mental Hygiene in New York City have been activated. They're now, staffing testing and vaccination, bubbles, as they call them, and they're being repurposed because they have an expected set of skills, but that really places a lot of demand on healthcare workers that they may not be used to addressing. So that's another level of potential stress and distress. Many HIV researchers have turned their attention to COVID-19, and our AETCs are very actively involved in training this healthcare workforce about COVID-19. This is another quote from the New York Times from a social worker this time. "Working through the pandemic daily has forced me to make adjustments in my personal life to protect the ones I love. I haven't seen my parents in more than a month. It gives me peace of mind to know that even if I happen to be exposed, I would not be transmitting it to them. This also brings sorrow. This is quite a time of uncertainty that will have a lasting impact on us all." I thought that was just a beautiful articulation of some of the things that we've been talking about. So how has COVID affected care team members? First of all, we may have had no time to deal with our own circumstances, but still we're expected to set aside our own distress to help clients, sometimes taking on work that's not part of our usual duties, as we were just discussing. Sometimes we feel guilt over helping our own family members first. And I know that was especially true at the beginning of what we were hearing about in the epidemic in New York City. There was a lot of guilt and a lot of worry about, I don't think I'm giving enough to my clients. I'm losing some of them. I've lost contact with some of them, but I need to take care of my family. And, how do you balance those competing demands on your, your loyalties? And often the community will turn to us, and we don't necessarily know more than anybody else does about COVID. This is a novel virus. We may not be able to help our coworkers if we're overwhelmed because everyone is, feeling that stress and strain. And we typically, when we're working in person together, we find ways of being each other's supports. But as we've been working more and more remotely, and maybe now that's going to start diminishing, it's been harder to keep those support systems together, although I've heard from a lot of providers that they figured out new ways to be that for each other. And then the healthcare system often is very hierarchical, and nobody really wants to admit that they're struggling. They're worried about, oh, am I going to be relieved of my duties, or, am I going to jeopardize my seniority here? What's going to happen to me if I tell somebody in my administration that I'm struggling with a behavioral health, a mental health, or a substance use issue? What is that going to mean for my work life? But I think overall, what we've also been hearing is that in a crisis, it feels good to be able to help other people and to be useful. And that's sort of one of the best silver linings that we've seen come out of this pandemic. So there are a lot of signs of distress that we want to just, make you aware of. You've probably seen these among your colleagues and maybe even in yourself. Definitely among our clients, we will see these. They're often are feelings of numbness, disbelief, anxiety, or fear. You may see changes in appetite, energy levels, your activity level, difficulty concentrating and sleeping. Maybe you're having nightmares and upsetting thoughts. Physical reactions are very common, such as headaches, body pain, stomach problems, even skin rashes that come out of extremes of distress. And sometimes some of the physical reactions that we experience overlap with some of the symptoms we're hearing about that are common among people with COVID. So that makes us worry even more because we think, oh, maybe maybe I have COVID. Then there's the worsening of chronic health problems. I spoke to a nurse who said, COVID knows our weaknesses and it goes after them. So if you have a pre-existing condition, COVID somehow just like hones in on it and really like hits you there. And then you may find that because you're feeling so many of these overwhelming feelings, you are quicker to anger or your temper is shorter than it normally would be. And then there's also been a lot of conversation about increased use of alcohol, tobacco, and other drugs as a way of helping us cope. And I know Steve's going to talk more about this in a little bit, other things that we may turn to as well that maybe are or are not helpful for us.
Karen, if I could just jump in, I've been spending a lot of time at the Cape, and I'll just say that the most successful business out in Provincetown these days are the two marijuana dispensary stores and the liquor stores, which are still open. And I just think it really speaks to a lot of people seeking solace in substances. So.
Absolutely. And, I think it's really important. This is like one of the main things I hope you'll take away from this talk. And, Steve and I and Liz and everyone who's part of this really, we're just hoping that there's one or two things from this presentation that you'll take away that will help you work with your clients, that will help you in your family life or with your loved ones in some way, shape, or form. But I think it's really important to understand that there is distress, which most people are going to feel under these circumstances, but there's also when the line or boundary is crossed and something becomes a disorder. So that's what we really hope to help you sort of, sort through here. So distress can occur in response to any adversity. It's obviously very common during COVID, and it's been more severe among workers in the front lines of those who are responding. It often doesn't meet criteria for a psychiatric diagnosis or require specialized mental health interventions. And we're going to talk a little bit later about who do you turn to, depending on what your experience has been. And then distress often responds very well to supportive strategies, and we'll tell you about some of those as well. What happens, though, when you cross this line toward disorder is that the things that you're experiencing may become persistent and severe, and that, you know, you may end up with a lot of ways in which you just are not functioning up to your normal capacity. So that's when you start to look for, oh, maybe I need to get an assessment for a mental health disorder. And there are these recognized diagnostic criteria. The ICD and the DSM are the most commonly used for purposes of you know, communicating about what a disorder is, and even for billing purposes in our country. And, you know, I just want to say we're not going to go into a lot of detail about these. We're going to show you some resources about how to find those kinds of assessments, but, you know, anybody's regional AETC should be able to give you more in-depth kinds of training about those diagnostic criteria. So I would urge you to reach out to your local AETCs if you're in need of those kinds of trainings. These disorders also call for evidence-informed mental health interventions such as medication and psychotherapy. And those will always be administered by highly trained people who are recognized behavioral health specialists. There is a subset of things that many primary care providers are very happy and willing to address with medication. And then, you know, in terms of these mental health disorders, the rules during COVID have been relaxed for providing mental health services by virtual means. And Steve, I don't know if you want to speak to that. If you've been doing a fair amount of remote work, I wonder how that feels to you and to your clients to receive and give care that way.
Well, I certainly think that it's changed the rules of the game, is what I would say, in terms of, you know, although telehealth has been around for a long time, it's really not generally been provided by mental health providers. And I actually think we're not going back. I think that for many people, just from an economy of time point of view, it's remarkably efficient. I don't find a big difference between seeing people using Zoom and in the office, although I still do both, particularly for people who are a little more isolated or live alone. I think still coming into the office is important. And I just read that Governor Baker just the other day is, I think, going to permanently reduce some of the barriers to seeing people using telehealth technology, as long as we're using encrypted systems of, you know, and Zoom has one for health providers. So I think this is a crisis that's going to drive an innovation in the way we provide care. I will also tell you in outpatient mental health clinics, the no-show rate is gone down dramatically. So just from a point of view of the systems working, many more people are both coming into therapy and are adhering and sustaining their attention. So.
Yeah, that sort of resonates with what we're seeing in New York as well. People are finding it in some ways easier, like the whole hassle over transportation vouchers has completely gone away for some settings. On the other hand, there are still a few people who I think feel that they're not as comfortable with the technology. There's a bit of a barrier. But I think as long as both options remain available to folks, that we're not going to lose people, you know, for their scheduled appointments for mental health services. So that's all to the good.
Karen, you're mentioning, though, something really crucial that I kind of forgot. And when I used to work with people with homelessness and doing HIV trials, although everybody had communication technology like phones, they often didn't understand how to utilize a lot of the functions. They didn't have, you know, so I think that is, particularly for disenfranchised people, we've got to invest in an infrastructure that enables them to do telehealth also. Really important point that I forgot. Thank you.
Yeah, agree. That's an important point. So I think, you know, after everything that we've been talking to you about already today, you probably are in touch with your feelings of anxiety, because we've been talking about a lot of difficult subjects. But anxiety really is a normal reaction to fear and stress, and it helps us react to situations that produce those feelings, So you'll see an array of reactions to anxiety, right? You see some people, it activates their fight response. Some, it makes them want to run away. Some, it may cause them to freeze. And I just want to actually show you that there's a lot that goes on in the brain that is encoded in our memory. This is what I was sort of alluding to earlier. You can have a very logical response and process information in a very rational way where you can decide, okay, well, everything's more or less okay right now, but then you have so many emotions that can overwhelm that kind of, cognitive, rational part of your brain, and those feelings can become part of sort of your wiring and how you then respond when any new, anxiety or fear comes your way, such that you end up with a very strong response for things that are not necessarily the most helpful to you coping with what's happening in the moment. So we're going to talk a little bit about that, but you want to make sure that when you're thinking through how your anxiety is acting upon you, that you're not in this sort of debilitating feelings, world where you're feeling faint, you're feeling shaky, you have a very strong sense of dread, you might even have this choking, reaction that you really can't even control, your heartbeat might be very rapid, and your legs might be wobbly. These are all signs that your body is really giving you that, the anxiety that you're experiencing is overwhelming the reaction that's going on in your brain, and this is how your brain is getting your body, in tune with that and ready to take some kind of action. The cartoon on the left is by Roz Chast, who I love, because she just has the perfect way of going to the depths of fear, despair, and neurosis and making it funny. And I think, it's important for us all to remember our senses of humor during this time. It can be one of the best ways of coping with something that's really overwhelming. But again, thinking back to that other diagram that I showed you about the difference between distress and disorder, watch for these signs in yourself and in your clients. These bodily signs can really be important communicators of what's going on in your stress response. So now what I'd like us just to do for a moment is pause. This is something that I want us to do together today, but also if you think about taking something home with you that you can try and practice, either if you're working or if you're, just in a stressful life situation of any kind. Pause, and this acronym really tries to encompass a number of things. So it means pause for a moment, just take a brief moment, analyze your breathing, your mind, and your body. So if your breathing, you notice, is fairly shallow and your mind is sort of racing and your body has some of those, trembling things going on in it that you saw in that little cartoon in the last slide, you can actually use this pause moment to try to re-regulate yourself. You can do some of that by breathing to reduce the tension, taking in a deep breath, holding it for a second, and then just pushing it all out. Really important way to just sort of ground yourself and get in touch with what you're doing. If you're spending all day on Zoom, you can sort of readjust how you're sitting in your chair, put your feet, both feet flat on the floor, give yourself the best posture you've ever had in your life and feel what that feels like, and do a stretch, do some movement, like reach up to the ceiling, as if your fingers, yes, I'm seeing Steve do it, as if your fingers can touch that ceiling, give yourself a good stretch, move around, stand up instead of sitting down while you're on Zoom, figure out how to make that work for yourself. And then getting back to the breathing part, make sure that when you're breathing, you are exhaling completely. There's nothing like taking that opportunity, if you wouldn't mind just doing it with me now, to breathe in a good inhale. And push it out as completely as possible. You may get the sensation, which is how your body actually can work very well for you, of a sort of lightness and a kind of floaty sensation. That can take like two minutes out of your workday to really help you ground yourself. So we are going to take a few pauses for the rest of the presentation, but remember, this is something that you can do anytime, any place. So this is some of the information that now is being generated out of the COVID pandemic. There has been nationwide, in 25 medical centers, survey of health workers. This was May, so things may look very different at this point in the pandemic, as you might imagine. This was more than 1,100 healthcare workers who were surveyed, and these investigators used various of the clinical assessments that we were talking about earlier. So they used the PHQ-9 for depression, the GAD-7 for generalized anxiety disorder, the PTSD-5, or this is actually the primary care version of it, PC-PTSD for post-traumatic stress disorder, and the Audit-C, which is a way of assessing hazardous alcohol use. These screeners are free to use. They're available on the National HIV curriculum, and we have a link to that curriculum at the end of the slide set, so you'll all be able to access these. They're super easy to use. You don't have to be a mental health specialist to use them. However, as a screener, you would want, if you find somebody is in kind of a worrying zone with these, you would want to then refer them to somebody who is a behavioral health specialist. But with the right amount of training, there's no reason that many, many, many people in healthcare can't use these. What was interesting is that they found that, the numbers in parentheses are basically the threshold for a worrying condition. So with depression, they found that 14% of those 1,100 healthcare workers, had something that needed to get a more advanced assessment for, but there was probable major depression in 14% of those healthcare workers. With generalized anxiety disorder, it was closer to 16%. For PTSD, it was about a quarter of the folks that they surveyed. And for alcohol use disorder, it was getting very close to 50%. So I want to just note that for men and women, the threshold for the Audit-C for alcohol use disorder is different because of, basically body mass and various other things that they take into account when they're calculating the number of drinks you're having in a day. But this is really some very important evidence that there are very serious mental health consequences of doing this work of caring for people. And we want to pay a lot of attention to our colleagues who are in these categories, who may be so busy with this work that they're not recognizing that they're in these kind of worrying zones. Same with
Karen,
Oh, go ahead, please.
I was just going to note that those rates for anxiety and mood disorders are not that unusual. Those are the most common mental disorders that we see anyway. About a quarter of us will have an episode of major depression across our lifetime. But the rates of PTSD and alcohol use disorder are really quite high, and not surprising, but I mean, that's really stunning. Typically, it's a criteria. The traumatic events, about 8 or 9% of people typically develop PTSD. So this is an unusual, extraordinary occurrence, and
Yes.
and many of those people who meet the criteria, that will fade with time. But for a number of people, it won't, and we'll have to all monitor that, I think, collectively.
Yeah, collectively, that's an important thing to do. So this diagram basically shows what Steve was just saying, which is that, outside of COVID, in general, in response to a traumatic experience, people have a range of different kinds of reactions. PTSD, which you'll see in that relatively small center bubble there, is not the most common thing that people will be dealing with, and it's the other mental disorders, depression, anxiety, alcohol, and other kinds of substance use. But then there also are the pre-existing conditions that might get exacerbated in response to a new traumatic event. But the other thing that I want to highlight here is just that there's also this potential for traumatic growth. So whenever there's a crisis, people actually often rise to the occasion. They find new ways of dealing with issues that they maybe hadn't been that successful at dealing with in the past. And Steve's going to talk a little bit about that as we proceed through the presentation. And I want to make sure we get there. And so I'm going to now go to the next. Let's see what's happening here. My slides are not advancing. Is anyone else able to do that?
So Karen, I have moved it now to the World Health Organization pyramid.
Okay. I can't
Which
see
I
it,
see
but
also.
yeah, can everyone else see it?
I can.
You're all looking
Yeah,
at it,
no,
right?
no, most people are saying no.
Okay.
People are saying yes now. Yes, no. It looks like it's a scatter shot. Who can see it and who can't? Oh, dear.
So, well, I don't know what to tell you because if you can't see it, I can describe it to you. But I want you to understand that what this World Health Organization pyramid is trying to do is describe sort of the optimal array of mental health services. Maybe someone can work on trying to advance the slide for everyone to be able to see it while I'm describing it. But if you think about the shape of a pyramid, right, the bottom or the base is much bigger than the top or the little tiny triangle at the top. And so what happens at the base is that there's a lot of self-care and a lot of informal care that happen in everyone's world. So those are things that can reliably be turned to for things that are distress, but not necessarily disorder. So self-care is some of the things that we're talking about in terms of wellness activities that Steve will give you more details about. But there's also, the community of like AA if you're struggling with alcohol use. Those informal care networks really can give you a lot of support when you're struggling with something. In the next sort of middle tier of the pyramid, what you see there are various kinds of mental health and substance use care that you can get in your HIV care setting, in a mental health care setting that's specifically for people with mental health disorders, or a general psych unit in a hospital. If you need something that's rather short term just to get you over a hurdle as you're trying to deal with a lot of traumatic issues going on in your life. At the very top is the sort of residential longer term care that not that many people will need, but some will. So what I love about this pyramid is that it sort of gives you a sense of the array of options out there for the intensity of the mental health care needs that you're facing, either for you or for your clients. So then the next slide. Yay, I can see the next slide. This is my final slide before I turn it over to Steve. So really the main take home here is to please seek mental health care when it's needed. If the stress is having an impact on your daily life and your activities and your functioning for several days or weeks, or if your symptoms feel severe to you, that is the time to reach out for formal mental health care. And there are many resources that we have at the end of this presentation that you can tap into, and those are available, including, free therapy. A lot of people like Steve have stepped up during this pandemic to offer their services for no cost at all. So Steve, take it away, please.
Great. Thank you, Karen. So what we want to talk about now is burnout and managing what we might refer to as compassion fatigue. And I think the World Health Organization pyramid was particularly helpful because you'll remember at the very bottom was self-care, which is what we're going to focus on, and second was community care or something like that. One of the challenges with the pandemic is that so many of us are missing our community, our informal networks of care, our informal contacts. I know one of the things that I perceive is that just not seeing, walking down the street and seeing the barista, or going to the dry cleaner, or greeting people in my neighborhood walking their dogs, because we're all under masks. That we're losing a lot of what sociologists refer as our soft ties in the community, which are also helpful. The kind of standing in line, chatting with somebody in the market, or just sort of particularly informal networks that you're not going to probably schedule a Zoom call with, but they're still important. Just talking and laughing with our colleagues, we're missing all of that. So this self-care is particularly important. Okay, so let's talk about challenges of coping. There's a variety collectively of what we're trying to do to cope. We can protest, or there can be an outcry. We can feel stunned, confused, anxious, and finding relief through angry outbursts. And I would just say that in my clients, what I'm seeing is the client that I have that has a tendency toward anxiety disorder and hoarding is more anxious and hoarding a lot more. The client that may wax or wane with his or her alcohol and drug use, that seems to have been exacerbated during this epidemic. A client who maybe has trouble with emotional resilience and emotional regulation is struggling with angry outbursts, particularly if they have a drink or two. There are also those of us who use denial and kind of head in the stand approach and bury or ignore feelings, which can work for a little bit of time, but particularly with a chronic situation like the pandemic, usually at some point some of those other feelings will break through. We can wind up, and this is the nature of PTSD in particular, with intrusive memories and emotions flooding in, particularly maybe at inopportune times when we're working or we're trying to work with our kids, problems with trouble concentrating and sleeping, and which I'm hearing a lot of. And so one of the things that we know about coping is that it is useful once an initial, the most severe aspects of the crisis waned a bit, to accept what's happening and being able to sort of process it and come up with a strategy to manage it and talk about the issues a little bit. So next slide. So facilitators, things that facilitate coping is obviously seeking support, seeking a support group around a traumatic event like the death of a loved one or a coworker. A lot of people, I know I lost a close friend this summer to COVID who was in an assisted living facility, dear friend of mine who actually we used to do some HIV work together. And it's been very important for a few of us to rally around and have little Zoom meetings and take walks to just talk about our friend and what she meant to us and that we miss her. And I think that another aspect of coping is taking a moment to feel good about things that you are doing, about sort of showing up at work, treating your patients, sort of being a stand-up person, if you will, and kind of understand that much of the work that healthcare providers doing, it's really it's a sort of sacred trust that we have with our clients, and that it's really important work that we do, even if the outcomes are sometimes that people get sick and die. We also want to realize that we have the ability to act and respond effectively, even when we're fearful, and that a part of managing anxiety is still being able to function. That's where the PAUSE acronym or mnemonic that Karen shared can be so helpful, that you take a deep breath, you stretch a little bit, you pause for a moment, and then you carry on. And so understanding that's another thing that will facilitate our coping. And that for a number of people, not just journaling, but there are all sorts of creative ways that people can build a sense of confidence and self-efficacy. Clearly, there will be a whole literature, particularly written by health providers, about their experience of this that it will be remarkable and is already starting to emerge. But there may be art and music and literature and other ways in which we build a sense of confidence and self-efficacy. My partner is the chair of performing arts, and I've been astounded, this is at UMass Boston, at the art that's being produced online through music and dance and acting as a way to reclaim a sense of coping, if you will. So when we talk about burnout, it's not a medical condition, and it's in some ways we use that colloquially a lot, but it is a condition or syndrome that we might understand is resulting from chronic workplace stress, and there's even some inventories that we use, and so a classic question on a burnout inventory is, I don't really care what happens to some patients. And this is the idea of the numbing that may happen, or the kind of just sort of shutting down. Anxiety can actually be motivating and can even help us in certain stressful situations, right? That's why we have evolved to be anxious people. But yet burnout is where you just sort of give up on a physiological and an emotional level, and that's not a good thing. So there are 3 R's to deal with burnout. One is certainly recognize and watch it for it. And so if you hear yourself saying, a lot of us that are in healthcare, we'll sort of use what might be inartfully called gallows humor, or we may crack jokes among ourselves, but where you're really starting to feel cynical about everything and negative about everything. You want to watch that. You want to reverse it by managing stress and seeking support and doing a lot of the self-care things that we're going to talk about in a little bit. And build resilience by attending to both physical and mental health issues. So, and particularly exercise is extraordinarily important at this particular time. So what do we do? There have been a number of papers that have that met criteria for inclusion about prevention and management of psychological effects of outbreaks, and looked at studies examining risk and protective factors for the psychological well-being of healthcare workers. And authors made recommendations in the following ways. First of all, we want to know, and I was distressed but not surprised that a number of you in the chat were saying that still the provision or the consistent provision of protective gear can sometimes be a challenge, particularly in the earlier periods of the virus, and that is uncalled for and extraordinarily frustrating. And we want to make sure that strategies that help, just general measures for increasing safety, and we certainly have to include the vaccine, as this is going to increase safety for a whole lot of us. And then there are things like ventilated rooms, reducing patient density, requiring everybody to wear PPE, creating a staff buddy system to support personal precautionary measures. In other words, I've worked with some patients who basically were saying, and some of you can maybe relate to this, that they felt like when professionals were dealing with their patients, they were very safe. But when they were dealing with one another, whether it was in rooms when they were charting or before and after work, that the culture, people were starting to slip a bit in terms of using PPE and other, eating together, those sorts of things, and that creating a kind of buddy system, a system of being supported in the desire to stay safe can be important. Obviously, enforcing infection control procedures, which is aligned with what I was just saying, is pretty important. Alternative accommodations for staff, particularly who are worried about infecting their families with these newest, exacerbation of the virus in New York and Los Angeles and a lot of other places in the country. We need to be making sure we're aggressively, actively accommodating staff. I will say that most of the physician staff these days seem to be getting vaccinated pretty quickly, certainly in this area, but a lot of the ancillary staff are reluctant and or have not had quite the same access, and we need to change that quickly. We want to make sure that There are video and other facilities for staff to contact significant others. Again, this was based upon research some months ago, so it's already out of date, although that still may be operational. And guaranteed food and daily living supplies. We found that that was crucial, particularly in the New York region during the last swelling of the pandemic. And then making sure that there's sufficient rest, time off, and breaks. This is something that I find a lot of people, the culture around healthcare doesn't often support. And I will say I think there's a sea change, and I don't think, I was telling Karen this earlier, I think our younger colleagues are not going to put up with it. I see a lot of people in their 30s who have just about had it, and they are really questioning some of the, particularly the hours, work hours and issues around productivity that they just see do not result in good patient outcomes. So some other strategies that help is training and education, obviously about infectious disease. Everybody, not just the medical staff, but also ancillary staff, case management staff. It's really important. I do a lot of consulting to case managers for people with HIV. And they need some training and education around infectious diseases, around the vaccine, those sorts of things. Clear and supportive communication strategies in care settings, peer and family supports, opportunities to reflect on the effects of stress, which I think is the whole thrust of what Karen and I are trying to do today, and access to psychological interventions as needed, and recognition of staff efforts, kind of acknowledging all the hard work that everybody is doing around COVID. So when we're going to switch briefly to compassion fatigue. Again, this is not a mental health disorder, but indeed it is a state of kind of physical, emotional, and mental exhaustion, and it is related to prolonged stressful work situations. If anything is illustrative of that, it's COVID. And it's often most common with exposure to traumatic events. Many of you in the chat mentioned losing many patients. At the same time, you're maybe fearful of your own health or your family's health, and so that's a very a tough kind of context in which to be working. And then also compassion fatigue is associated with insufficient resources, and still in many places in the country there are insufficient resources, whether it's PPE or it's access to the vaccine or it's clarity about who's getting it when, and those are all factors that can cause compassion fatigue. Some other issues are workplace contributions to compassion fatigue. Lack of control. Many of us have felt a lack of control in this whole thing. Confusing expectations, where lines of authority of what supervisors and others expect from you seem to be confused. I would just say working in a large, complex university, one of the largest privates in the country, in a medical center, I can say that expectations are not always as clear as they might be around COVID. And it often takes a while to work out some of the kinks whenever we adopt new strategies, and having clear communication strategies around that, even to say things are going to be a little ragged here for a week or two, bear with us, we're doing our best. And then dysfunctional dynamics that may have pre-existed but are exacerbated by the epidemic, so bullying or workplace environment where you don't feel appreciated by colleagues, or perhaps where a boss micromanages you. One of the things that we do know is that if you take highly internally motivated people, and I would say people particularly work in areas like HIV are often internally motivated, and you micromanage them, the only thing that does is decrease motivation. And that's basic behavior therapy, behavior modification. You want to kill somebody's initiative, you hover over them and micromanage everything that they do. And a lot of our systems have people who manage in that way, and it doesn't work. It can sometimes help people who are not internally motivated, but it kills initiative for people who are in it for the right reasons. So, and then again, this idea of conflicting values, and if your values differ from your employers, or they're emphasizing different things in you. So we want to save some time for questions, so I'm going to speed through this a little bit. We do know that from a satisfaction standpoint, that enjoying compassion is an important factor in motivating to help. Having, kind of, taking pleasure in being compassionate is important, and it can help you to feel, one of the things about our work collectively is we know that what we do helps people, or we shouldn't be doing what we're doing, but that we do important work, and that there's a lot of happiness and joy or sense of satisfaction and perhaps even provider joy that can come from that. And some contributions to satisfaction or feeling as if you have compassion to give is clarity about that you're going to do the work, or kind of contract for that. Working during the day, night shifts and overnights are tough. I know a lot of people do them, but that's hard. And again, it's much more difficult to, having experience with traumatized patients can be problematic, and that feeling part of a team is also important for compassion. Okay. Workplace contributions to compassion satisfaction is that making modifications in the structure of work and its processes. And I've been impressed with some of my private patients in healthcare settings where there have been some issues that have brought them up, and actually with people's listening around things like PPE, or perhaps needing to change a shift, or perhaps taking a slight leave, or making some modifications to accommodate kids at home doing virtual school. And so that helps a lot with creating an environment where people can maintain their sense of compassion. And that is aligned with improving workplace relationships and offering professional development opportunities for professional staff and others. So one of the things that kind of this take-home message, and this was Karen's slide, and it's just, I love it. Know your limits. One of the things that we do in healthcare is there's a competition often for who works the hardest, who came in the earliest, who left the latest. And we refer to that sometimes as humble bragging. We often are in a culture where we try to outdo one another about our work ethic. And it doesn't matter what other people need to do. You need to know what you can tolerate, and then find an environment in which you can operate that will respect your limits. Easier said than done, but knowing your limits, it doesn't matter if somebody else sleeps 4 hours a night, right, or 5 hours a night, and then is good to go the next day if you require 7. So some of the signs and symptoms of you knowing about what your limit is: to pay attention, observe yourself, stop yourself and take time out to rest. I know one of the things that I've started to do since I've been in my 60s is I take a nap almost every day, almost religiously. I build that into my schedule. And what I found is that sleepiness that often overtakes me in the evening when I see patients doesn't happen anymore. So I take 25 or 30 minutes every day. I eat lunch in 5 or 10 minutes often, which is I'm a fast eater anyway, but then I do take the nap. I took the nap actually just before today. And then I get up and rinse my face off and have a cup of coffee, and I'm good to go. So I know that's something I need, and it's good for my body, it's good for my soul, and it makes me feel like I'm taking care of myself. And in my office, I have a little yoga mat, and I lay down underneath my desk. I can kind of hide so no one can see me, and I have a little mask, and I take my 25-minute, I would say 4 or 5 days a week. I'm successful in doing it for the full half hour. So again, stop yourself and taking time to breathe. Listen to what your body and emotions tell you, and treat yourself with the same care and respect you give to your patients. I often say to my patients that if you that they talk to themselves and they do things to themselves, that if they were doing it to another person would be a form of abuse. And so you want to treat yourself with at least the same respect and dignity than you treat other people. So when we talk about self-care for providers, we had we thought this is just not a poll, but in the chat, what are some of the things that are particularly stressing you out? And if you could just take a few minutes and put that in the chat box. I see a number of you liked the idea of treating yourself with the same care you give other people. And someone talked about the current political climate, and we didn't get into it today. It was sort of beyond the scope of what we said we were going to do, but oh my God, yes, I'm with you. And I'm have to decide, am I worse reading the news or am I better for it? So unrealistic work expectations, COVID, I'm scared myself. I haven't gotten the vaccine yet, and I'm 66. I can relate. Knowing your limits, learning a new job, absolutely. Well, somebody mentioned the not being able to hear. I will tell you that I am hearing, I'm seeing some patients in person with a mask and a HEPA filter behind, and I think I pick up about 60% of what's happening. But in some ways, well, masks, okay, worried about getting sick, keeping my staff healthy, COVID. So a lot of you are worried about the virus, worried about that the care may be subpar. And another way to frame that is it's the best that one can do in the present environment. And that's distressing for people that are healers, right? So significant numbers of critically ill patients with very low CD4 returning to care due to fears associated with the pandemic. It's been very challenging. And we know that a lot of people, particularly with HIV, have histories of physical and sexual abuse in childhood, and that can also lead to all sorts of outcomes, including also psychiatric disorders and non-adherence and a lot of anxiety and depression and substance use that makes them difficult or challenging to ally with. So thank you all very much. So again, we want to take this moment now to pause using that phrase and, sort of take a deep breath, sort of analyze what you're feeling in your body. Take a deep breath in and hold it. Take a deep breath out. And then stretch a little bit. I don't know about you, but I'm one of those people that when I'm anxious, I hold my breath. And a lot of times it's as simple as taking a deep breath in and breathing out. So I think one of the, another issue, and I love this slide, again, compliments to Karen, is that I think those of us in healthcare often are people with high needs for control. We're used to controlling things, and that often, sometimes our outcomes are worse than other people who maybe are not under the illusion that they can control very much. And so that you want to focus in life on the things you can control. You can't control the circumstances of your life, but you can control your attitude. You can control whether you follow the CDC recommendations. And I think we could get into a whole thing about anxiety and anger and how that impacts people using masks or not. We can control our own social distancing and kindness and grace. I'm trying to do that even in the context of people not social distancing and occasionally not using masks. I would say I've lost my temper on more than a few occasions and been the grumpy old man. But I'm trying to decide, okay, if I social distance and I mask, I'm going to often let it go. Listening to social media, limiting social media, I will say. I think I was just sharing, I'm not sure how much it's helping me or hurting me to watching the news. I find reading things, I can titrate what I let into my consciousness more and put it down and pick it up. Watching it, sometimes I feel assaulted almost by watching too much TV and stressed out. And then finding fun things to do at home. I mean, one of the things, so what are you doing? You know, we did this in another context of a workshop, and I was amazed at the number of things that people are doing: baking, dancing, crochet groups using Zoom. You know, we need to have some fun here. Jeffrey Oppenheim, a neurosurgeon, we found this quote was that he had found it important to contain his emotions in the context of his work. But in the last few months, and this was in the context of COVID earlier on, he'd cried more than he had in decades. And allowing himself to feel vulnerable was cathartic. I don't know about you, but I noticed that I was reading the Who Got Married the other day in the New York Times, and I found myself weeping. And I find myself sort of tearing up whenever I see some human interest story or some act of kindness or grace, and I know that's about just feeling more vulnerable. Sometimes it does help. It can be cathartic. We know that tears are cathartic. Anger is not. Anger just foments more anger often, but tears can be cathartic. And so some other aspects of self-care to build resiliency is talk about your feelings. Try not to feel, this is hard, about responsible for tragedy or frustrated by not having been able to do something directly to rescue people. I think the question for me is were you a stand-up person? Were you there? Did you show up during this extraordinary time? Did you do for your family and or your patients what needed to be done? And that's maybe enough. And then you also want to adopt these methods to promote your own well-being through healthy food, rest, exercise, relaxation, and meditation. So I think we're getting close, but I'm going to just, we'll talk about effective approaches. We've talked about relaxation, some mindfulness. I can't tell you how important sleeping is. We talk about psychiatric diagnosis. If you're not sleeping well, you and we need to fix that because that's the leading edge of a lot of bad mental health outcomes. And so we talk about, for instance, sleep hygiene, sleeping in a very dark room, sleeping in a cool room, sleeping, not having anything that beeps or goes, sets off alarms in your room, comfortable pillow, comfortable bed, and not exercising 2 hours before you go to bed. There are a whole bunch of things that go with good sleep hygiene, not eating 2 hours before you go to bed. But there are a whole bunch of things. Really try to get good sleep because nothing goes well when you don't.
Steve?
So Dr. Brady?
Yeah.
Go ahead, Karen.
Yeah.
I
think we're...
Yeah, I wonder if people have questions for us, and just to sort of give folks a sense of what else is in the slide deck that they're going to be given access to, in addition to think through some of the other approaches they might try.
Why don't we take questions, Karen, and then as we do that, maybe you could field the questions and I'll scroll through the slides. How does that sound?
Yeah, that's great. Or we can just stop now because everyone will have access to everything that's here. And one of the things that I want to mention is that we have a lot of great resources at the end that you guys can get access to. But do people have questions for us?
And as a reminder, you are currently on mute, and unless you will have to unmute your line by pressing #6, or you can put your questions in the participant chat. But at this time, yes, you will have to unmute your line, #6.
I can see I didn't go quite quickly enough. Sorry about that, Karen.
No, well, we had a lot of polling time at the beginning too. I think folks, if you see that there's like a sort of exercise that you can do at home around these 8 dimensions of self-care along with some other tips, those will be very helpful potentially for you and those around you. And I don't know, Dr. Brady, if while we're waiting for questions, you want to just get to the last slide about the wounded healer. But
I sure do.
You spoke about well-being toolkits that were presented at a Ryan White conference. So
Karen, why don't you go?
Yeah.
Why don't you take the wounded healer?
Oh, well, I mean, or we could just leave it there for folks to read. Tammy in the chat box was asking a question about a toolkit at a Ryan White conference, and this was for the folks in Puerto Rico. It's actually in both English and Spanish, and if you're interested in seeing what's in that, I'd be happy to send it to you. It might have been archived already because it was a couple of years ago, but my email's at the end of the slide presentation. I'd be happy to send that around to folks. Any other thoughts?
Somebody mentioned a white noise machine for sleeping, and it does work really, really well. We have a white noise machine. Yeah, great idea.
Are there any additional questions? Again, you can unmute your line #6, or you can write them in the chat box. We do have 2 minutes remaining, and I did put up the resources, the resource slide.
Teresa mentioned that even though the weather's cold, she tries to spend some time outdoors, even at night, watching the stars. I can't tell you how important it is to be outside 15 or 20 minutes a day. And if possible, to get a little sun on your extremities, really helpful for mood management. I was out, I did my walk for 15 or 20 minutes also this morning. Just so crucial to feel part of the earth and the world, particularly if you live in an environment where you're not worried about getting COVID and you can walk outside. So.
And to feel that there's something larger than you and even this pandemic right now in this moment, it's so important to connect with that feeling.
Absolutely. So thank you both. I want to thank Dr. Stephen Brady and Karen McKinnon for that excellent talk today. I feel that was extremely helpful. And thank you all for participating. So as a reminder, today's webinar has been recorded. The webinar recording and the slides will be available on the AATC NCRC website within 1 week. That is the link you see right now in the current slide. We have also added it to the participant chat several times. If you have any questions, you can feel free to reach out to myself, Liz Lazo, at eira@sn.rutgers.edu. The speaker contact information, again, is also on that slide. We hope that you join us for the next session in our webinar series, which will be on Wednesday, January 27th, and that information is on our website. Thank you, and everyone have a wonderful day.
Thank you, Liz, very much. Thank you, everyone.
Thank you all so
Good
much.
luck.